Hello and welcome to this Womankind Health special edition on intimacy. My name is Emily and I'm a clinical specialist in pelvic health, and today I want to talk to you about intimacy and pelvic pain. Now, we commonly hear one of the first things to go out the window when you're experiencing pelvic pain, whether that's from an overactive pelvic floor or maybe from an other condition like endometriosis or prolapse, that intimacy, quite understandably, is something that gets interrupted very, very quickly. And this is partly, other than the fact that it hurts, it also is to do with the fact of safety. In order for us to be intimate and give pleasure and receive pleasure, we have to feel incredibly safe. And pain, and especially worry and fear about not really knowing what is causing your symptoms and why they hurt and what you can do about it, does not make us feel safe. So today I'm going to go through with you a few things that you can do at home to explore what might influence your symptoms. I always talk to, if you've ever had physio with me or you've listened to my other videos, I always talk about the body's conversation. So your symptoms are just your body's conversation with you, trying to tell you what it needs. It's not having a go at you. It's not telling you you're broken, even though it might feel like it. It's just asking and showing you what it is. The problem is, we don't really talk the body's feelings, we talk emotional reactions. So that's our job as physios. We just act as translators, we help you work it out. So these three things are for you to explore, have a go at, and see how they influence your symptoms. That influence, that response you get back, is your body responding to you. So we respond with a physical kind of change in the body, your body responds back again, and it's just a conversation that we're having. So first thing is something I call directional breath. So we've probably all taken a few deep breaths when we're really stressed out or maybe trying to calm ourselves down. You may even have done some meditation and relaxation before. Directional breath is actually something that I use when I'm doing a pelvic floor examination, checking the muscles internally and looking at overall tone and relationship of the pelvic floor of the diaphragm. So with the directional breath, this is a technique that I use to see what is maybe driving that overactivity, that tightness or that discomfort in the pelvic floor and in the pelvic bowl. So let's do it together. So I want you just to start by taking a few steady deep breaths in and out. Just don't overthink it. A few breaths when we say nice breath in and breath out. Okay, now I don't want you to make yourself dizzy, so we're just going to do a few of these in each direction. So first of all, I want you to take those deep breaths into your belly button. Seeing, can you create a little bit of openness and softness there? Now you don't have to push your tummy out to make that happen. Just allow the breath to move into the belly button and back out again. And then when you've done 2 or 3 breaths there, I want you now to take your breath down into your perineum, so between your sitting bones, so really low into your pelvis. And again, what does it feel like to take the breath there? Okay, and once you've done 2 or 3 there, you're now going to take that deep breath into the curve of your lower back. So imagine where your lower back and your pelvis meets. Can you direct the breath to there? Okay, so hopefully you've done 2 or 3 in each of those directions. Now normally I'd be doing this alongside an examination and we'd have this conversation of what did you feel, what did I notice, and we'd usually kind of talk about either the differences or where we're marrying up in terms of the effect on the tone, the tenderness and the behaviour of the pelvic floor. Because you don't have me there, I'd be asking you, how does it feel for you in the terms of where feels blocked or restricted, like I just can't breathe into that area, it just doesn't seem to change. Or where does it feel like, actually when I breathe into that, I feel like my body changes, it responds in some way. And it can be just as vague as that, or you can be like, oh yeah, I can feel like my tummy relaxes or my back relaxes, or I suddenly feel a little bit more calm in my body. It doesn't really matter, but it's a great place to start of doing deep breathing control into those areas. And if you're not sure, just rotate through. Breath into tummy, breath into perineum, breath into lower back, and keep that going through in a cycle. Okay, so that's number 1. Number 2 is all about ensuring that your body doesn't categorize all touch and all intimacy as threat. Now, understandably, if you've got pelvic pain and pelvic floor dysfunction, which is causing you pain, and penetration or maybe climax is causing you discomfort, that is not the only part of intimacy and sex. So one of the homeworks I often set people who are experiencing difficulties with penetration and climax is actually exploring pleasure. I give you a pleasure homework. You spend the whole week exploring pleasure. So whether that's pleasure of the music you're listening to, the clothes you wear, the textures, the food, anything you want it to be, and looking at where you can upgrade pleasure in your life. Increasing that sense and showing your brain that it is safe and it has pleasurable things that it can enjoy, and reinforcing those pathways within sort of your brain and your behavior in your body as well. The next step to that is exploring pleasurable touch. So we kind of have a quick chat around the body and go, okay, let's kind of divide it up into zones. What are some kind of painful, sexy zones that you just like, do not touch? So usually it'll be somewhere around labia, clitoris, groin. And we go, okay, you are not allowed to touch those areas. We're just gonna go, they are a no-go zone for now. They are off the menu, okay? And then we go, okay, well, what are some areas of your body that are just really neutral? So a lot of people usually say sort of back of my hand or maybe my elbow. Okay, so this is really neutral. It's like, just my elbow. It doesn't feel particularly sexy. It's okay if your elbow does feel sexy though. But for example, here, my elbow, it's just an elbow. That's what it feels like. There's no pain there. I've got no dysfunction apart from my jumper's a bit tight on my elbow there. I can touch it. It doesn't cause me any problems and I'm aware of that, okay? Then we'd go somewhere between that, going, okay, well, what is somewhere that maybe feels intimate that you would only really let your partner touch, but isn't this sort of zone, no-go zone? And a lot of people usually say across the chest, maybe the small of the lower back, maybe the inside of the knee and thigh. We're looking for those sort of between areas. So we start by just going, okay, can we touch the area that is feeling really neutral? And just go, this is very safe, this feels absolutely fine. And you can bring all sorts of sensations like tickling, little light scratching, pressing, rubbing, all those areas are going to go, it just feels how it feels, yeah? Then you're going to bring that into a more intimate area. So let's say that the front of your breastbone here felt a little bit more intimate, but completely kind of comfortable and safe. You would repeat all of that. And then you'd include your partner in that as well, going, right, can we touch this? And then repeating that for them as well, going, okay, well, we're going to do the whole, my no-go area is also your no-go area, and we're just going to explore all sorts of touch, connection, hugs, and I ask them to try and do a hug for a prolonged amount of time. So minimum of 6 seconds, ideally 20 seconds. So I'm looking for pleasurable, intimate touch that doesn't involve any sort of kind of direct clitoral or vulval touch, if that is a trigger area for you. Okay, so we've got our directional breath to help calm down the nervous system and see if we can influence the tone of the pelvic floor and the tension that you're getting in response around your body. We've got this intimate touch that we can explore kind of from neutral to no-go area to somewhere in between. A great way to still maintain that lovely connection with your partner, but also explore pleasurable touch for yourself. The last one is I'm going to show you one of the stretches that we explore. And again, see how this feels. I'm going to be facing slightly away from the camera so you can see the leg, my leg angle. So coming to lay onto your bed, leave it near the edge of the bed. I'm going to come and have a little lie down, and then I'm going to let one leg dangle off the bed. Can you see how my leg is going down behind me? And then I'm going to gently bring the other leg towards me. Now, if this feels okay on your back, then you can proceed to the next bit. If it doesn't, I would get, my plank is quite high, but I would get something underneath my foot, so a step or, a pile of books or something, so I don't have to sort of hang into my leg. My knee can be very slightly lifted, okay? The idea of this stretch is to kind of almost rotate and lengthen out the pelvis. So I'm going to draw my knee that is kind of lifted towards me and then out. So I've got this diagonal line rotating out with the top leg, rotating down and away with the bottom leg. And I would stay here using that directional breath either to the area that kind of influenced my body the most, or down into the area I feel the stretch. So for me, I'm feeling it a little bit more here across the front of my hip. So that's where I would send my breath all the way down through my groin, through my leg. And I would stay here for about 30 to 40 seconds, and then bringing that leg back in, and if I need to, help that leg back up again. Have a go at that on both sides. This is a nice one to do before any aggravating activity, whether that's physical activity, whether that's sex, whatever it might be, adding that in to try and influence those symptoms. Ultimately though, I really, really do appreciate how much that loss of intimacy and the impact that has on relationships. Obviously, I would encourage you to get some counselling if this was becoming quite distressing, especially if there's been any history of unwanted touch. But we do offer here as well health coaching alongside all these practical physio tips as well. And this is something that I see works really, really well in our approach here, helping people to engage well with their health overall, understand what's going on, but also get the practical help. So if that's you and you're kind of going, yes, this is me, and I don't want to lose my sex life, and I don't want to kind of let this take over life completely, then give us a call. We're very happy to help, and I can talk you through how we can work through coaching, those practical tips, and really make that recipe that's unique for you. So I hope to see you in clinic soon. Thank you for joining me on this special intimacy edition of Love Your Pelvic Floor.